So thanks a lot for the invitation, and as introduced in the next minutes, I will talk about the CD8 T cell response induced by the SARS-CoV-2 mRNA vaccination. And but first I want to jump in to talk about the CD8 T cells in natural infection to motivate why they are possibly important. And CD8 T cells, they go through an effector phase in the acute infection, and then also have the capacity to establish a memory response. And they are really well recognized effector cells also in the natural SARS-CoV-2 infections. And most studies focused on the analysis of the overall SARS-CoV-2 specific CD8 T cell response by using peptide pools. So by this approach, you can really map the overall response, but you do not map the kinetics and dynamics on a single epitope level. And this was exactly the question that we had. So what is now really the kinetic of the SARS-CoV-2 specific CD8 T cells on a single epitope level in natural SARS-CoV-2 infection? And to investigate this, we had to identify epitopes, CD8 T cell epitopes that are recognized before we could then develop the tools to identify these cells. And we did this by in silico prediction of peptide epitopes and that are restricted by common HLA alleles, at least in most populations worldwide. And we selected the top 5 of the predicted epitopes and then stimulated PBMCs with the peptide pools for 14 days and then re-stimulated the cells and performed flow cytometric analysis. And by doing these analysis in a cohort of 26 convalescent SARS-CoV-2 donors that had recovered from mild disease, we could detect responses in roughly 88% of the tested donors. And we even could detect CD8 T cell responses in donors that were seronegative for anti-spike or nucleocapsid IgG. But now to really address the question about the kinetics, we had to validate the epitopes that were predicted and confirmed, and these were 33 in a total, and we had to validate these for dominant epitopes. And at the end, we came up with 6 dominant epitopes restricted by different HLA alleles and located at different viral in different viral proteins. So now, having these epitopes in hand, we generated so-called peptide-loaded MHC-1 tetramers, and this is a reagent where you can really detect the specific CD8 T cells targeting this specific epitope you generated the tetramer for. And what we realized when we did so and stained or want to identify these cells directly ex vivo, that the frequency was quite low. And therefore, we decided to increase our detection rate by performing a tetramer-based magnetic bead enrichment. And in this technique, you label your fluorochrome labeled tetramer with a magnetic bead and perform then a magnetic bead-based separation. And by doing so, we increased the detection sensitivity and then could further analyze the respective SARS-CoV-2 specific CD8 T cells for the different epitopes. And with this technique, we can also back calculate then the ex vivo frequencies. And when we did this, we saw that the frequencies were quite low, and you can see here in black as a reference the influenza virus specific CD8 T cells. And what we also realized is that the frequencies differ with respect to the targeted epitope. Now, having the tetramers, we then followed a patient that developed mild disease and with a known infection event. So we could really do the kinetics. And we could appreciate that the CD8 T cell response, as depicted here by the green dots for 2 different epitopes, is induced rapidly. So we could detect a decent fraction 1 day after symptom onset. And then it has like a prolonged contraction phase, the CD8 T cell response. And we followed the CD8 T cells response for up to 100 days post-symptom onset. And after having seen that the CD8 T cell response is rapidly induced and had a prolonged contraction phase, we wondered about the memory or the early memory of the CD8 T cells. And to check for this, we stained for CD127. So this is the IL-7 receptor alpha chain. And this is really important for the homeostasis of the CD8 T cells. And we also checked for the expression of BCL2, the anti-apoptotic molecule. And again, here in blue and green, the SARS-CoV2 specific CD8 T cells, and in black, the influenza specific CD8 T cells. And what you can directly see is that the expression of CD127 and BCL2 is increased in the influenza specific CD8 T cells. But when we had a look at the expression, and it is depicted for BCL2 on this slide, dependent on the time after symptom onset, we realized that the expression is increasing with time post-symptom onset. And therefore, we think that the difference in the CD127 and BCL2 expression of SARS-CoV2 specific CD8 T cells compared to influenza specific CD8 T cells comes from the time post-infection. And these led us to the conclusion that the cells that we detected reflect an early memory cell. We also wondered about the functional capacities of these memory T cells. And for this, we performed in vitro testing. We expanded the cells for 14 days and then checked for their functionality. And we calculated the expansion index, so how good do they expand, and also calculated their interferon gamma and TNF production, important effector cytokines of the CD8 T cells. And we couldn't detect great differences to the influenza specific CD8 T cells. So the SARS-CoV2 specific early memory CD8 T cells are functionally competent. So to sum this first part up, we saw a rapid induction, a prolonged contraction, and the formation of a heterogeneous and functional memory, at least up to 3 months, of the SARS-CoV2 specific CD8 T cells in natural infection. So in this strong induction of the SARS-CoV2 specific CD8 T cells raised the question about the induction of the SARS-CoV2 specific or the spike specific CD8 T cells after SARS-CoV2 vaccination. And since the mRNA vaccine by BioNTech Pfizer was the first approved vaccine in Germany, we focused our research on this vaccination regimen. And already the first data that were published by the BioNTech people themselves, they show that the vaccine induces a polyspecific T cells in humans. But again, we wondered about the kinetics and the dynamics of these CD8 T cells on a single epitope level. And the study design was to follow 32 healthcare workers that have not been infected before. And we collected blood and serum at baseline until roughly 200 days after boost in a 3 to 4 day interval. So really tight collection of blood. And we've chosen 3 different epitopes. On the one hand, a A1 restricted one A2 restricted one, and an A3 restricted one. And all these epitopes were not conserved among other coronaviruses, including the common cold coronaviruses. And And they are all conserved in the variants of concern alpha, beta, gamma, and delta. And the responses that we detected, they are part of a much broader response, overall spike-specific CD8 T cell response that is induced after mRNA vaccination by the BioNTech Pfizer vaccine. But they also represent responses that are dominant, as you can see here for the A1, the A3 restricted, and the A2 restricted CD8 T cells. And we again generated peptide-loaded MHC-1 tetramers and performed magnetic bead-based enrichment and followed the frequencies. And these are again the calculated ex vivo frequencies. And we could appreciate that the CD8 T cell response is readily induced already 1 to 2 weeks after the prime vaccination. So we had really a rapid induction of the CD8 T cell response. And after the second dose vaccination, we realized that there's a boost expansion of these CD8 T cells. We next wondered whether there's a classical effector response released by the mRNA vaccine. And for this, we stained for the activation marker CD38, for the proliferation marker Ki67, and for Tibet high. And this is a classical characteristic of really good effector T cells. And we could see that we have like a classical effector response after prime vaccination, but also after boost vaccination. And we then wondered whether there are some differences in the effector response after prime and boost vaccination. And for this, we compared the phenotypic characteristics of these cells at peak expansion after prime vaccination and peak expansion after boost vaccination, and performed high dimensional analysis and could see that there are clear differences in the effector cells generated after the prime vaccination and after the boost vaccination, with increased expression of effector markers after the boost vaccination. So we have a boosted effector response after the second dose vaccination. Now, having analyzed the effector response, and we saw that this is really a classical, we also wondered, now what about the memory response that is generated? And in the beginning, at the memory precursor pool. And memory precursor CD8 T cells are characterized by the expression of CD127 and of the transcription factor TCF1. And we then calculated the frequencies of the spike-specific CD8 T cells that express these markers. And what we realized is that the cells were readily induced, so the memory precursor cells were detectable about 2 weeks after the prime vaccination, and then they remained stable. So there is a stable memory precursor pool induced already after the prime vaccination. We, of course, also wondered about functional capacities of the cells. And for this, as we've done it previously, we had an in vitro expansion for 2 weeks, and then we re-stimulated the cells and checked for their expansion capacity and cytokine production. And when we investigated the functional capacity as depicted here for the expansion capacity in the middle and on the right, the interferon gamma production, we could see that the early induced CD8 T cells are fully functional. So the mRNA vaccination leads to the emergence of functional spike-specific CD8 T cells. And again, we wondered whether there is a difference in the functional capacity of the spike-specific CD8 T cells after boost compared to the prime vaccination. and compared again the cells at peak expansion after the first and the second dose. And then compared the multifunctionality of these cells. And we couldn't detect differences. So conserved functional capacities after prime and boost vaccination are induced. Next, we then wondered about the memory establishment after mRNA vaccination by the BioNTech Pfizer vaccine. And to get a broad impression, we first checked for the expression of BCL2, and we could see an increase in the expression of the anti-apoptotic molecule BCL2, and this increase of the BCL2 expression is a sign of the establishment of a memory, a CD8 T cell memory response. And we then compared the memory after mRNA vaccination depicted in the circles to the memory after natural infection depicted in triangles. And these are time point matched. So we matched the time point after the boost with the time point after symptom onset. And we could realize that the frequencies of spike-specific CD8 T cells were higher after mRNA vaccination compared to natural infection. And of course, based on this finding, we wondered whether also the quality of the spike-specific CD8 T cell memory is different after mRNA vaccination compared to natural infection. And we could detect some differences in the subset distribution. And subset distribution means we have different subsets of memory T cells with different functional capacities and migratory features. So here it is depicted for the central memory cells that express CCR7 and can therefore locate to the lymphoid organs. And we have the transitional memory cells and the effector memory cells depicted on this slide. So in addition to the different frequencies, we also observed this different subset distribution of spike-specific early memory CD8 T cells after mRNA vaccination compared to natural infection. And we wondered whether these phenotypic differences are also evident for other markers. And we also stained for the activation marker CD38. And also here we could detect differences. In particular, we observed a higher expression of this activation marker after natural infection compared to vaccination. So these phenotypic differences might be due to differences in the inflammatory milieu, antigen presentation, route of antigen delivery, etc. And so we, of course, also wanted to know whether there are differences in the functional capacity, and again performed this in vitro expansion. And here you see that we couldn't detect differences in the expansion and also in the cytokine production of the spike-specific CD8 T cells after mRNA vaccination compared to natural infection. So similar functional capacities, while the phenotype is different of the spike-specific early memory CD8 T cells after mRNA vaccination compared to natural infection. So to sum this up, after mRNA vaccination with the BioNTech Pfizer vaccine, we observe a rapid and stable mobilization of CD8 T cells by the vaccine. And this has also been observed by the group of John Verry for the CD4 T cells. So this seems to be right for CD8 and CD4 T cells that these are rapidly induced. And this also raises the question about the relevance of the T cell immunity for the protective effect after the mRNA vaccination. And when one has a look at the onset of the protective effect of the mRNA vaccine, then it is around day 10. And a report by Kalimudin et al., they also observed this early T cell induction, and they extrapolated this with the onset of the protective effect. And so the CD8 T cells most probably mediate early protection from severe disease after prime vaccination. Now, is this induced CD8 T cell immunity relevant against the protection of the variants of concern? And as I've introduced, the responses that we have looked at, they target epitopes that are conserved between the variants of concern, but other groups also realized that the CD8 or the majority of the CD8 T cell epitopes are unaffected in the variants of concern, meaning that an induced CD8 T cell response has a relevance in protecting or controlling also the variants of concern. Now, there are several open questions, and this is for sure about the long-term memory. So we have followed our cohort for up to 3 to 4 months. And there are really recent paper out now, and they followed their cohorts for 6 to 7 months, and they can still detect a T cell memory response. But of course, we have to see. And another question is, of course, and I mean, Dwayne also implicated this, what are the differences to the natural infection? And I mean, there are first data out from the epidemiological data from Israel, and they see that the immunity induced after infection is superior to the immunity after vaccination. But I think we will learn about this in the next month. And with this, I'm at the end, and I would like to thank the team, and it was really a joint effort of many people, and it was done in close collaboration with Christoph Neumann-Häfelin and Robert Timme, and I really want to mention Janine, Valerie, Isabel, and Hendrik, who did most of the works. And of course, thanks also to the patients and the volunteers. Without their blood, this hasn't been possible. And thank you for your attention.
Thank you, Maike. Again, I'll ask panelists and attendees to just raise their hands if they have any questions. And I'll kick us off by asking, when comparing your vaccinated cohort to naturally occurring infections, does the severity of the natural infection matter? Is there greater variability in the initial responses for naturally infected patients, for example?
So in our analysis, we compared these to the mild disease. But there are differences in the immune response comparing, or the T cell response comparing mild disease and severe disease. These are not our data, but it has been published that the coordination of the immune response is much more tight, or it's better controlled in the mild disease. So, but these data are just for infected patients with a mild disease.
Andy has a question.
Yes, a question both for Maike and for Dwayne. Is there evidence that a third shot of the mRNA vaccines can affect the memory B cells or T cells, the pool, the expansion, the phenotype of the cells, so on?
So we are really curious to see that, and we are just collecting blood to perform the analysis. This is just what I would expect. It is that we, of course, see a boost, but the question would be, what about the decay and the quality that comes at the end? So because if you, just for the T cells, if you boost and boost again, then you drive more terminal differentiation, and what we would like to have for maintained memory is not a terminal differentiation, but we have to see.
And I guess I could comment on that other question as well, since you mentioned Time will tell. I don't have the data available to me with what's happening with the boost from the memory cell component. Perhaps Ali could comment as well on this. I think Ali, you might have some great insights on this. I would expect a boost, like the interval between prime and boost, or between infection and vaccination, for instance. The memory B cell compartment matures for months after stimulus, either infection or vaccination. So like a 3-week, I think it makes sense at the time to do that, but I think a longer interval between prime and boost makes sense because the memory B cells will be more mature. On average, the probability is higher affinity memory B cells, and those tend to, that might help prime a longer, more durable response.